We are back on MorningLine. It's our pleasure to have with us this morning Dr. Calvin Smith from over at Meharry. He's terrific, talking about some of the latest developments with regard to COVID. And we just touched bases on vaccines. They're coming. Now's the time to go get them if you're 6 to 9 months out from your last shot, or if you have a pre-existing condition that makes you more at risk. By the way, it's really interesting. I didn't know this. This next shot you're going to get is exactly the same as the other shots you got. It's just a booster.
Just a booster.
Just a booster on that. I wanted to ask you on this, too. When we get the shots now, you're protected. Nothing's 100% guaranteed. We do hear of some breakthrough cases.
Right.
But so people are saying, well, there's breakthroughs. But the big deal is, if you have the vaccine, and breakthroughs are going to happen.
Yes.
What does it mean? It means that because you've had the vaccine, the illness will not be as bad.
That's correct. So your immune system is just a little bit stronger having seen and been exposed to the vaccine than it would be without the vaccine. Okay. And so with that being the case, even if you're exposed to it, number one, it greatly reduces the risk of the virus being able to invade your cells. But if they do happen to invade your cells, it's going to be a short invasion. It's not going to be nearly as protracted as it would be, especially if you were already prone to being really sick with it. What we notice is that some people who probably would have died are surviving. Some people who probably would have had severe illness are not having to go to the hospital. Yeah. And some people who might have had just mild illnesses don't have any symptoms at all. And so it's kind of stepwise in terms of that.
Gotcha. Let's take a few phone calls. We'll go to Barbara. Barbara, good morning. Hi, Barbara.
Hi.
Hey, go ahead, ma'am.
Yes, I'm going to be due for my next vaccination, the third one, about November. And that's usually the time I get my flu shot and my pneumonia shots. Will those counteract each other, or should I space them out a certain amount? Or
great question. Yeah, flu shot time. Yeah, we got to talk about the flu. Yeah, thank you for that call.
That's a fantastic question. Actually, from everything we know right now, there's no need to space out these shots. You can get, much like we would do with kids, get multiple shots in the same day.
In a row, yeah.
So I don't think that based on the literature right now that there's anything to say that you shouldn't get those shots on the same visit, the same day. As a matter of fact, I want to talk real briefly about the flu because if you noticed last year, the flu was conspicuously absent.
Yes.
We didn't see a whole lot of flu cases. I wonder why. People washing their hands, wearing their masks. I'm sure that the flu vaccine also helps a great deal. The flu is a much different kind of bug than the COVID.
Yeah, the COVID shot is not going to protect you from flu, will it?
No, it won't.
Two separate shots.
Two separate shots. But with that being said, you don't want to be in the mix of thinking, oh man, is this COVID, is this flu, like that kind of deal. And you certainly don't want to be down with both of those at the same time. That would certainly be a lot of burden on an immune system. So certainly, even if you still have some reservations about the COVID, which I mean, from a scientific standpoint, there's not a whole lot of reason to have a whole lot of concern about it. But if you still do, I still strongly encourage you to get the flu vaccine and really do the same things you did last flu season, because we have record low numbers.
Yeah, that's awesome.
The numbers are there. Science is there.
I was healthiest last year than I have been in years. And what I mean by this is because we really had limitations here at the station. They did a great job with it. I was wearing a mask, washing my hands, not around as many people. Every year, I get at least one bad head cold or something. I didn't get one last year. And it's because of all this. Now, I know things are opening up again. I anticipate I've already had a sinus infection this year. But yeah, I think that's the way to do it. So get the flu shot. Have you heard anything at all about this season's flu? I know they look at Asia sometimes, and they get a guess whether or not it's going to be a worse type of flu this year compared to other years. Any word on that at all?
No word as yet. And that's somewhat concerning to me, because usually around this time I have some way to advise a lot of my patients who are immunocompromised as to how, what they should be on the lookout for.
Yeah. But
I haven't heard anything about any cases one way or the other, whether the flu season is going to be severe or not. And I think a lot of that is in large part to the fact that even in Asia they had such lower numbers that we just don't really have the volume of cases to look at, which is good and bad. It makes it a little bit more unpredictable. That being said, the science behind the flu vaccine is so well studied and so well, at this point we kind of are in a routine with it, and with the hand washing and masking and everything like that. I mean, I don't anticipate it making a resurgence. I pray to God it doesn't happen, because we certainly don't need that on top of.
Yeah, you're right. And someone getting both of those would just be devastating. Let's go to next is Jane. Jane, good morning. Hi, Jane.
Hi, how are you?
Good. What's on your mind?
I'd like to know why I haven't seen any of the medical professionals on television talk about ways to strengthen your immune system, such as eating antiviral foods, which I've been doing for over 9 years, and I haven't been sick in over 9 years. But, nobody's talking about eating antiviral foods or taking supplements. They're just talking about the vaccine.
Okay, yeah, let's talk about some of those.
Sure.
I'm not sure where exactly she comes from if she chooses to go that route instead of a vaccine, but I certainly think there are things, right, that you can eat that strengthen your immune system, maybe coupling that with the vaccine.
Well, I think she's right, and to her credit, we don't do enough on the preventative end to talk about things.
Okay.
And I think it's because we are in this this emergent pandemic sense, you know what I mean, where the horse is out of the barn, so to speak. But to her point, to prevent people from becoming ill, yes, a good healthy diet, she referred to as antiviral, things like high in antioxidants, vitamin C. We certainly are seeing people with low vitamin D are faring much worse than people without that issue. So making sure that you get a good, healthy, balanced diet with vitamin D, vitamin C, getting some sunlight, some real activated sunlight, not the filtered sunlight from the windows, but actually going out to, even if you're like quarantined, going out to the balcony or your doorstep and just getting some good sunlight for about 15 minutes will activate that vitamin D and will help protect you. But to her point, I mean, I think that, yes, we do need to do a better job of advocating for healthy habits prior to getting sick. So eating a good balanced diet. And if we're eating a balanced diet, I like to use that word specifically because a balanced diet is going to contain just about everything that we need to be healthy. And that includes those antioxidants, that includes vitamin C. But those things will only serve a certain measure of protection. And certainly, if you've never been exposed to a virus before, that virus can overwhelm even the healthiest immune system, depending on the circumstances. So, but you give yourself your best chance to fight it.
Yeah, my wife, I think, is like her. She takes good care of herself and very rarely gets sick. And I'll be honest, I get a flu shot every year, always have. My wife hasn't, and she's never gotten the flu, and so it stood up. But when it came to COVID, there was no question in her mind. She went and got the vaccine for that. And because she sees it as very different. I just want to be clear that there have been stories, and I know of someone individually who said, well, I can handle COVID. I'm going to take zinc tablets, vitamin D, lots of vitamin C, and I'll be able to fight this off. And that person died. Okay? I want to be real clear that what she's suggesting here, while helpful, is not going to save you if you get COVID and or protect you from that. It's not a substitute for a vaccine.
That's absolutely correct.
Okay, let's just be real clear. And so, she may disagree with me. I'm sorry, then I disagree with her. The bottom line is vitamin C and D is not a substitute for the vaccine.
Sure. I think all of it is here for us, and neglecting any one part of it, especially the vaccine, is tantamount to ignoring the other end. Like you're doing all this, you're building up all this immunity, and then not bolstering it. It doesn't really make a whole lot of sense to me if the science is behind it. You know what I mean? And the science is certainly behind it in this case.
Yeah. Well, like I do what she says. I try to eat those foods and stuff. I've got the vaccine, so I know if I'm a breakthrough case or something, I'm hoping what I end up having is a very mild kind of feverish feeling, and I get better in a day or two. That's my fingers crossed on that.
Yeah. Odds are really high that it won't be severe.
Yeah, and that's a relief for so many people. That's why I just don't understand why people don't get the vaccine. We'll talk more about why they don't when we come back too. We'll take calls from Ron and Shirley and others right after this. Stay with us. Back with more with Dr. Calvin Smith. We will be back.
This is a Storm 5 weather update